Hi, and welcome to my very first episode of How to Speak Cancer, the podcast. Well, I thought I'd start with a little introduction. My name is Kathrin Kunze. I'm a German, English, Swedish, and Latin medical communicator. I work with translations and also I create a lot of content all around cancer and clinical trials. Why do I think that is a good thing? I've been working as a nurse for 20 years. I started my medical career when I was 6. I started at the Red Cross in Germany, the youth department. So medicine has always been my life, and I've always enjoyed looking after people and caring for people. Due to some health conditions, I can't nurse anymore. So I started working as a medical communicator, and this is what I'm doing. I'm communicating, right? So these days I translate, I write books, I write blogs, I host now 2 podcasts. This podcast, How to Speak Cancer, and the other podcast is called Med Talks with Kathrin, where I invite patients and patient organizations as well as other stakeholders from the industry and HCPs. And we talk about all kinds of medical topics. Yes. So how did How to Speak Cancer come into your hands? It all started last year when I started to write down some notes for myself, actually, about biomarkers and staging and all this, how to best translate that. And then I thought, actually, my medical communication colleagues, they might also want to read this. And then I wanted to prepare a handout. And then I thought, no, actually, this could be a great topic for a book for patients and caregivers, their loved ones. So I turned those notes into a book, and I wondered how can I talk about cancer in a way that isn't frightening or sterile or cold. So because I love nature, which is why I'm sitting in the forest, I have my dog with me. I go for walks every day. So I love being here and thought I will take you with me. So I choose to use medical storytelling and metaphors from the garden because I thought that for me personally, the garden is like a paradise. I love to be there. I love to listen to the birds. I love to see my flowers bloom. I love to eat my own tomatoes and cucumbers. And I just thought this is a very nice set of bringing your mind into when you want to talk about cancer, because I pictured myself, I remembered back when I was walking my patients in the parks of the hospitals. This would be the place where I would talk to them. I would sit with them on the bench and maybe eat an ice cream and just talk. So I wanted to bring the garden into the book, and I think it is easier to understand heavy context when you use metaphors from the everyday life. So I did that, and I published a book. And soon after the book came out, that was in September last year, many of my translator colleagues came and were like, "Wow, this is amazing! And what a great set of putting things." And I must say, I was very hesitant actually to publish the book, but after like 3 weeks or so, I had an amazing team of volunteer translators, and now this book is going to be available in 18 languages. German, Swedish, and English is already available, but it's much more than the book. Actually, it's a movement. It became something important to many people to help patients understand what's going on. When patients get the diagnosis, you have cancer, then usually they don't hear anything else after that. which is also why I wanted to give them some guide into their hands. But then I didn't want to make it heavy. Again, there's the garden. So what can you expect from the podcast? This podcast goes along with the blog of How to Speak Cancer. So whenever you want to read what I told you or a summary of that, then feel free to come to my website, katrinkunze.com, and read the blog to it. If you want to have this more into detail, then you feel free to get the book, either as an ebook or a paperback. And how will I structure that? Well, I will hold myself close to the structure of the book. I will go with you with each episode one step closer to or one step deeper into the process. We will start very easily with what is cancer, what are the hallmarks of cancer, can I prevent cancer, and then we will talk about biomarkers, about staging, about diagnostics, about companion diagnostics, about clinical trials, palliative care, all the therapy stations we have. And this is going to be almost like a course where we step deeper and deeper and deeper into the topic. So if you don't want to miss a new episode, click the follow button and then you will be notified whenever I upload something. I'm looking forward to your comments. Please feel free to reach out with any questions I might cover in the next podcast. There will be some special episodes where I might invite some survivors, where I might invite some caregivers, or answer your questions. I'm really excited and I'm really looking forward to this. All right, let's dig deep into the next episode. I'll see you there. Bye.